This is the Cancer Boss Method podcast, the place to be when cancer sucks and you don't want it to. I'm Leslie Nance, survivor, cancer coach, and healing mentor. Come learn the truth about what your role is in your own healing. No BS, just real strategies from a cancer coach who has been there, done that. And I'm talking about healing. Hey there, beautiful souls. Welcome to the Cancer Boss Method, where we dive deep into topics that matter when it comes to healing, to hope, to taking charge of your cancer journey. And today we're going to talk about, should you get a medical port for chemo? And while we're talking about that, and since we're talking about a medical device in this episode, please remember this is not medical advice that you're getting from me here today. And I want you to always consult with your medical team before making any decisions about your treatment path. And so if you don't know me, my name is Leslie Nance. I'm a certified holistic cancer coach and oncology nutritionist and a fellow traveler on this path of healing. And I have had the privilege of coaching thousands of women through their healing journey and their cancer treatments. And can I say, after seeing both choices, to port, to not to port, I can confidently say that the women who choose a port are almost always happier with their decision. So I get it. I am all for less surgeries and fewer procedures and reducing stress wherever possible, but I'm also about less complications and a more peaceful way of healing. And that's why when it comes to chemotherapy, I firmly believe that a port is the best option for most people. But we're going to take a closer look at that. So today we're talking about that big decision that many of you will face when you're starting your chemotherapy. Should you get a medical port or should you go with a PICC line? Just spoiler alert, I'm pro port all the way. But let's break it down and explore the pros and cons of each and talk about how to see a port as a tool for healing rather than just a medical device. So before we dive into the specifics of a port versus a PICC line, let's talk about why this decision matters. Because here's the thing, chemotherapy is already a challenging process, and the way that your treatment is delivered can make a huge difference in your comfort, in your safety, and your overall experience. And some people feel overwhelmed when they are faced with this choice. But let me tell you, every single time, knowledge is power. So understanding the difference between these options is going to help you make the best decision for your journey, which is what's most important. So what is a port versus a PICC line? So first off, a port, I'm calling it a port. It's called a port-a-cath or a medical port. And it's a device that is implanted underneath the skin, usually in the chest area, either side, but usually in the chest area. And it connects to a large vein that allows chemos and fluids and blood draws through a special needle to access that port. And it does require a minor outpatient surgical procedure to place the port. The other option is going to be a peripheral inserted central catheter, and that is called a PICC line for short, right? Because you don't want to have to say that whole big thing every time. So it's called a PICC line, PICC. And a PICC line is a catheter placed in a large vein. Think about an IV. It's a catheter that's placed typically in a large vein in the arm somewhere with tubing that extends outside the body. Now, the PICC line does not require surgery, but it does need to be inserted by a trained specialist. So let's talk about those pros and cons, because I know these are the things that you really are here to hear about. So now that we know what they are, what are the pros and cons? So pro port, let's start there. First of all, there is less risk of infection when it comes to a port. Since a port is completely under the skin, the risk of infection is much lower than a PICC line, which has external tubing that can be exposed to bacteria. Now, ports do get infected. It's incredibly rare, and they can help you very easily with an infection if it occurs. So if you see anything suspect around your port area, you want to make sure and ask the right questions about that. A port is actually better for long-term use. So ports are designed to last for months or even years as long as it's getting proper care. So with PICC lines, those often need to be replaced after several months. Also, that there's no external tubing. So there's nothing dangling outside of the body, reducing the risk of pulling or snagging. You can continue to be active, and because that pulling and snagging can actually be painful and it can be dangerous in some situations. And then, of course, you have less vein damage. So ports are placed in a larger vein where a PICC line can be in a smaller vein overall, and it can cause damage to that smaller vein. And then over time, it can actually lead to permanent scarring. So in my opinion, it is definitely better for medication delivery because certain chemo drugs are harsh on those smaller veins, and a port makes it a safer option for those treatments. And then more comfortable. After it's healed, after that initial healing period, after your little outpatient surgery, most people barely notice their port day to day. So it is definitely more comfortable once it's healed. Both more comfortable just day to day, but then also as they access it, it is just a much more humane way to get treatments, but then also to get blood draws, to get fluids. I mean, there's so many things that they can utilize that port for. There are some cons when it comes to port, and that is, the first one is the big one, of course, right? Because I said surgery, and you're like, oh crap, I don't want surgery, right? It does require a surgical procedure. So placement of a port is a minor surgery that requires an incision in the chest and some recovery time. Not long. Sometimes you get a port and the very next day you get chemo. So just know that it's not a long period of time that you're going to need to recover from that, but it does require some, and it does require that you take good care of that surgical area while you're healing. The other thing is that the port must be accessed with a needle. Now, it is a special needle that they use, and unlike a PICC line, which stays open and ready, the port requires a special needle to be inserted each time that it's used. And some people find this uncomfortable, though I will tell you, numbing cream can really help, and just ask your chemo nurses about that, and they can set you up for success. And then not everyone is a candidate. There are some medical conditions that, and I'm not going to cover those here, but it's a question you may want to ask, or if you've been told you're not a candidate for a port, it's usually due to some sort of medical condition. It could be because of where the cancer is as well. But for some people, it's unsafe to place a port. So it's important to discuss that with your doctor. And then the port is going to need regular flushing when it's not in use. So if the port isn't being accessed regularly, then it must be flushed with saline to prevent clotting. And this is just something you have to show up and have done on a regular basis. And don't miss those appointments. It's quick. It's easy. Just if you're not getting regular treatments, if it's not being accessed routinely, then you want to make sure that you're keeping that port flushed out so that you don't get any clots in it. The other thing is that it can be uncomfortable for some. So I just got through saying how comfortable it is, but depending on your body type, depending on certain sleep positions, depending on the placement, depending on the individual's tolerance, some people feel like their port, can feel their port more than other people can. But generally speaking, I would say mostly people do not feel it. Okay. The other thing is, just thinking about the pros of a PICC line, is that there is no surgery required for a PICC line. It can be placed in an outpatient setting, and it's done with local anesthesia, and you avoid the needles, you avoid the need for any surgical procedure. So the initial placement of the PICC line is a process that is much quicker. It doesn't require as much recovery time as a port does. It is definitely a pro for some people. And then also thinking about that, the PICC line can be good for short-term treatments. So if chemo is only needed for a few months, then a PICC line might be a viable option for you. And then if you have a fear of needles, since it stays accessed all the time, it does not require a new needle stick each time that it's used. But honestly, you can just look away and use your numbing cream, and you're not going to know when they're accessing your port. I'm just going to throw that out there, even if you have a fear of needles. So there it is, because I'm pro port. There are some cons with the PICC line. One is that it's a higher risk of infection because it remains outside of the body. A PICC line has a much greater risk of infection. So strict hygiene is required to prevent those complications. And you're going to want to follow whatever rules and regulations that they're giving you around that. It also requires more maintenance overall. You have to change a dressing frequently, and it needs to be flushed out also to keep it from clotting if it's not in use. For me, the biggest thing is that a PICC line can cause some severe inflammation and irritation, for long term in veins in the arm, and it can cause some damage, and that makes future like IV placements really, really difficult. So if you're having treatments for a longer period of time, then you definitely want to consider a port over a PICC line. The other thing is that there is a higher margin for medication errors. So certain chemotherapy drugs must be administered carefully when using a PICC line. There is a slightly greater risk of incorrect administration when it comes to a PICC line. So the last thing I want to say as a con is that sometimes it can mean a slower infusion process. So some chemotherapy drugs must be infused more slowly through a PICC line compared to a port. So you can just ask that question and double check with your medical team for the specifics of your treatment, because clarity is the key to healing when it comes to even making these types of decisions. So if you want to live as normally as possible while undergoing treatments and you're a candidate for a port, it is by far the best option for normalcy, because a port allows you to shower without covering anything. It allows you to move freely without worrying about dislodging a line, and it significantly reduces the burden of constant maintenance. So if comfort and ease and long-term use are your priorities, a port is a clear choice for you. Again, as long as you're a candidate. So when do you get it out? How long does that sucker have to stay there, right? The short answer is when you're ready. The removal procedure is typically done in the office and to remove the port, and it's much easier than the placement procedure by far. If there's no evidence of disease and you are done with treatments that have been planned for you, the doctor may recommend the removal. Some people do choose to keep it as a precaution, while others are ready to get rid of it as quick as possible. As far as the PICC line is concerned, as soon as you're done with treatments, they will remove the PICC line and they can place another if they need to. So if you have questions, or maybe let's think about it this way. If you have questions, yes, please post them below. But if you have a port or a PICC line and you want to share some wisdom, please do it respectfully. Share it below and let's hear like some firsthand examples of I love my port, or here's why I don't like my port, or here's why I like my PICC line, or here's why I don't like my PICC line. Or maybe you went from a PICC line to a port, which is a possibility as well, and vice versa. So let's start a discussion about that, because this community that we're building is the more we talk, the more we empower each other through this process. So the bottom line for me, in my opinion, as a holistic cancer coach, is don't fear the port. It is a great, humane piece of technology that makes your journey much easier. So repurpose that mindset around that particular medical device. And can I just say one last thing? If you're listening to this and you're like, oh, this is great, somebody to answer my questions, somebody that like knows my concerns, make sure that you check out the Chemo Boss Holistic Protocol. It is a self-paced program. It's designed to help you heal faster. It's designed to help you reduce side effects and to support your body during chemotherapy. So if you want to learn more, I'll drop the link below. Until next time, I want to remind you, stay strong, stay hopeful, and keep being the boss of your healing. If you have enjoyed this episode, it's time to connect. Make sure you follow this podcast and check out all the socials on anystagecancer.com. If you're ready to talk about your own healing using the Cancer Boss method, then click the link below this episode. Hey, and remember, cancer's not your destiny. Okay, I'm outie.